This is Dr.Hetal, board certified, practicing OBGYN in northern New Jersey. I really want to thank all of you from bottom of my heart for all the wishes, love, and prayers. COVID virus has been around now since November, as we know of, and I've been following it since February. It's ironic that it's actually a month since I've been talking about it on Facebook, on radio, as well as TV, and then now talking about after having experienced it firsthand. Um, as we know that a lot of things are changing and a lot of things have changed. So I'll talk about a few things which are still the same and what things have changed. So the thing about the COVID virus that it's a very contagious virus. It's an RNA virus, COVID-19 virus. It attaches to human cells and it mainly attacks the lungs, right? So what happens, the way it's a respiratory system virus. What we knew before and what has changed now as far as the transmission is concerned, it's not just a droplet. Droplet is when you're close contact, when you're talking, the drops that come out. And that's why there was a 6 feet, distance that we had to keep. But now it's also thought that it is aerosolized, right? That means it can transfer through small microparticles and it stays in air for at least 4 to 6 hours. So the air we breathe, if somebody has been there before, has coughed there before, and we go there, we can get infected. So that's a difference that we know that it's an aerosolized as well as droplet. Also, there is some fecal-oral transmission as well. So from the cleaning, if there is any fecal matter which is left on any, it can transmit through that as well. So that's another change from the time we knew about the COVID. Now, I want to emphasize why staying at home is so important, right? As we all know, flatten the curve. What does that mean? So if all of us are outside, we can transmit either through the droplet, through air, infection to others. Now, I would say 97% out of 100%, that means 97 people out of 100 are going to be doing well, right? Only 3 to 4% will really become very, very sick. So what happens, some of us are what we call as asymptomatic carriers. We don't have symptoms or maybe very, very mild symptoms. We go home, we give it to our elders, right? So the person who is asymptomatic might not even know how many people they have infected. And that's why when we stay home, we are reducing the number of people we expose the virus in that asymptomatic or the prodrome stage that I had mentioned in the last video. So that's why staying home is very important, because you might be fine, but you carry that virus home, and somebody who has high risk factors, cardiovascular, hypertension, diabetes, immunocompromised, elderly people, all that can get affected. So staying at home is still important. Washing hand is still very important. Avoid touching your face is still very important. But what I would add now, please, please, please wear a mask. If you can't get surgical mask, you can make your own mask. Even a simple thing like making a bandana is going to reduce the amount. Not completely protect you, but it's at least going to reduce the amount. Wear gloves, right? So that way you reduce the surface, but don't wear the same gloves and touch everything. Like the articles that has come from outside, or you're touching the doorknobs or public places. Once you're done with it, please discard it in a right fashion. Don't throw them around. Put it in a garbage so you don't infect more people. Some people have been using the gloves and throwing it down, exposing it into open places. Please don't do that. So that's still in effect, right? What's changed is wearing mask and covering our face when we go outside. I highly recommend doing that. So stay at home, avoid touching your faces, cover yourself, reduce exposure, don't meet more than the family members that you are staying. Don't try to do play dates, don't go around, don't do parties. I think there are so many different ways of connecting with people without physically being in touch with these people, either through FaceTime, Skype, and different other apps that you can, be virtually having meetings or social gatherings without being physically in the vicinity. So those are the few things which are important. Now, why it is important to know the prodrome syndrome, and I really want to explain now since I have some more energy to discuss. As I mentioned, like, we didn't know about those initial symptoms. So first few days, maybe 1 to 4 days, you might feel really exhausted, tired, no energy, loss of taste. We didn't emphasize that enough earlier on, but loss of taste, loss of smell, these are some of the signs that if you feel it, please isolate yourself, because if you'll reduce the number of people that you are coming in contact with. And if you start developing fever, shortness of breath, or cough, as I had explained earlier, shortness of breath is like you can't carry out a sentence or your day-to-day activity without gasping or stopping and trying to take deep breaths. That's shortness of breath. Coughing, which is usually a dry cough, and fever, anything more than 100.6. If you have this, please let your primary care know, because I was lucky enough to start medication earlier on. In spite of that, I was what we categorize as severe case of COVID-19, because my saturation, my pulse, my temperature, and my overall medical appearance at that point puts me at a severe case. Critical is when somebody really needs to be intubated. So if you have a mild symptoms or earlier on, if you get the treatment, be it anti-malaria tablets, be it some antiviral medication, or if it's a severe or critical, they are giving a lot of other immunomodulator treatments. Why it is important? Because when the virus is attacking your body cells, it's releasing what's called cytokines, and those cytokines are doing the damage, right, to the lungs, and then it's leading to heart issue. Now we are finding out that it might be causing small thromboembolism. That means the blood is clotting and stopping it, some of the vasculature. That's why some people have abdominal pain. They come with myocardial infarction. Also, some people are having a neurological stroke, seizures, confusion. So we still don't understand it completely, how this virus is attacking so many organs, but we know that it's because of the release of this cytokines, interleukins, that's causing it. And that's why by starting anti-malaria tablet, you're stopping this surge, this release, and minimizing the damage to the lungs. So it's very important that we are aware, we get the testing, hopefully sooner rather than later. That way we pick up this COVID people, we isolate them, and anybody who has symptoms, we treat them earlier on. Because once the damage to the lungs is done, once you become critical, that's when it's very difficult then to kind of completely treat it. So there are a lot of different treatments in the hospital. Excuse me, they are available for this hospitalized patient. Depending upon which hospital, there are different trials which are happening, and people are getting better. I really want to emphasize that you seeing me now, I was a severe case of COVID-19 and I'm here. I want everybody not to panic. 96 to 97% of the people are going to be fine. There is only 2 to 3%, depending upon the morbidity and mortality is associated with it. Also, we thought that it really affected 50 and above population, but we are seeing more and more cases in 30s. We have seen as young as a few weeks old baby, but those are not, they are called outliers. They are not the cohort, right? They are not the main people who get affected, but nobody is immune. So that's something to keep an eye on. Now, I really want to emphasize what you should do. So please isolate yourself, call your physician. If you think you fit into this criteria, please get tested, and early on get the treatment, because that's really important to get treated earlier on. Otherwise we'll end up with complication, and then it gets a little difficult to get better. So what has changed from what we knew before is that please wear the mask. Please, if you go out, please wear the mask. We know that it can affect younger people as well. There are some early treatments available, and hope that will help understand the disease. Some days I feel like going back in time and changing what we knew and educate more people, or just fast forward ourselves and let this pandemic be behind. But we are stuck here, and we are going to be here for some time. So please, let's take precautions. Now, a lot of people are asking, so what happens after 2 weeks of isolation? What do we do? When are we going to be able to come out? We still don't know, but I think what I understand that we should come out in small. We should not completely go back to a normal, right? Maybe start with essential thing. Maybe start with schools. Maybe start with other essential things. Start going out for a few businesses, and then we can integrate different groups back into society. The idea is to develop either a herd immunity, that means once most of us will be subclinically infected and have an immunity, so we can kind of halt this pandemic. But if we all go out together, we might have a second surge of the infection. So it's very important. We still don't know, but that's the understanding, that please assimilate back in slow and steady way. We still should avoid large gatherings. We should still avoid unnecessary gatherings. But when it will be right time, I think each government and each state is going to make their own protocol. How do we assimilate back after the isolation is over? I think COVID has given us all a time to reflect and think what's important, what's not, and how we can be a very responsible citizen of this earth to each other, and what's important in life. I think that's what has come out of this. I hope this helps. I would do a more. If you have any questions, either you can inbox me. I'll be putting this on YouTube channel also, where you guys can reach out to me directly. It's www.youtube.com, and you can search Dr. Gore Show, and it should be there in that. It's also, I'll be in some WhatsApp, Instagram, as well as Facebook. You can follow me at betterumedicalspa.com or at Hetal Gore. My Facebook ID is Hetal Gore. Thank you so much. This is Dr. Hetal Gore. Till next time.